Hi, this is Dr. Nina Naidu, and I'm just going to be going over a few of the most frequently asked questions that I receive in my practice. These are just a few random questions. I will certainly be adding to these, so if you have any specific questions about plastic surgery, go ahead and put them in the comments and I will try and get to them. So one of the questions that I receive very often is about bra use after surgery. The important thing to remember is that your bra will not shape your breast. Your shape comes from your own inherent natural tissue and its own natural shape, as well as the work of your surgeon. So the bra is not going to do the work for you. However, bras will provide support to the breast. After breast augmentation, I generally will recommend that patients wear a surgical bra for 7 to 14 days just for comfort. It gives you nice support while the swelling's coming down. For my breast reduction and breast lift patients, I will actually suggest a 6-week period of wearing a bra, day and night if possible. And the reason for that is that this just takes attention off of the incisions during that primary healing period. I found that patients who can adhere to this tend to have much flatter, thinner scars after the healing process is done than those who go without a bra. Another question I frequently receive is regarding the use of drains. So the decision to use drains rests entirely with your surgeon and his or her preferences and experience. I'll just tell you what my own preferences are. For the breast, I don't use drains after a primary breast augmentation. We found through clinical data and many studies that they're really not necessary and they do increase the risk of infection. However, after a breast reduction, I do use drains, and what I find is that if I remove them on postoperative day 1, that is the next morning, patients will have significantly less bruising, less drainage, and a faster healing period. For breast implant exchange cases or breast implant removal cases, I will place the drains and I will remove them on the first postoperative day. Again, when a capsulectomy is performed, I will leave them a bit longer. And a capsulectomy is when that scar tissue around the breast implant is removed. That creates a fair amount of trauma to the breast. It can result in bleeding, a lot of fluid accumulation. So generally those drains are in a bit longer. I'll remove them when the drainage is less than 30 milliliters or 30 cc's per drain per day. And that's usually around postoperative day 3. Showering after surgery. Again, follow the recommendations of your surgeon. It's based upon his or her own experience. For my patients, I recommend that they can shower the evening of surgery if they want to and if they feel strong enough. I do not recommend that you get into the shower immediately after taking any narcotic medication. In my own practice, I almost never give narcotics, so most patients are just fine taking medication and then getting into the shower. If you do have drains in place, you can hold them in one hand and then let the water just hit you on the back, and that way you'll prevent the drains from being pulled at their insertion site, which would be painful. Most of my patients do prefer to wait until the drains have been removed before they jump into the shower. However, keep in mind that showering is not going to induce surgical bleeding. If you've heard that, that's absolutely not correct. It is safe to shower after surgery. Exercise after surgery, again, follow the recommendations of your surgeon. However, in my practice, I will let patients exercise after breast surgery as tolerated at about 2 weeks postoperatively. I do recommend that they begin gentle arm movements and chest movements the night after surgery. This helps to really build up strength and get you moving again quickly. When you do return to exercise, start at a lower level than normal and go back up to your normal exercise level within the next few weeks. Just listen to your body. If you feel pain or discomfort, stop for 1 to 2 days and then try again. Exercise is not going to cause your implants to move into your armpits. Again, the surgical pocket is created at the time of surgery and your implant will stay in this space. So you have your own natural anatomy. We work with that. Exercise is not going to change that. Capsulectomy. A capsulectomy, as I mentioned before, is the removal of scar tissue around a breast implant. It can be partial or it can be complete. Now, typically, I will do this for grade 3 or grade 4 capsular contracture or proven cases of cancer. Grade 3 capsular contracture is when that scar tissue is very firm and it may be distorting the breast. In grade 4, you have those symptoms as well as pain. I do not perform a capsulectomy solely at patient request because this is a big procedure. It is associated with specific risks, including bleeding, pneumothorax, which is a puncture of the lung tissue, prolonged drainage, and increased pain. So there really has to be a good medical reason to perform a capsulectomy. It's not just an optional add-on. There have been several recent studies that have shown no benefit to prophylactic removal of the capsule in the absence of grade 4 and grade 3 capsular contracture and cancer. Scar creams. I once had a patient tell me that scar creams are like eye creams. Neither one really works. I would respectfully disagree with that. Scar creams do actually work, but you have to be compliant. The ingredients are also important. Silicone is one of the most commonly used ingredients in scar creams, and it has been shown to be very helpful in reducing scar thickness and scar color. And you'll find it used in most medical grade scar creams and gels. The massage of the scar also seems to help break down your scar tissue. There is an alternative scar balm that I formulated myself and which I offer in my office, and it uses rosehip seed oil, sea buckthorn seed oil, and Centella asiatica. These are all ingredients that have been shown in a number of clinical studies to reduce scarring and to help with wound healing. So I use this in my own practice as I do have patients who are sensitive to silicone in the scar creams. Keep in mind that everyone's body is different. Scars will fade at different rates depending on both your skin tone and your skin quality. So those are just the few of the most frequently asked questions that I receive in my practice every week. If you want more information, please visit my website at naiduplasticsurgery.com. You can also give us a call at the office at 212-452-1230.